So you take yourself to an Ayurvedic physician, and what do? Every physician has to diagnose, or every practitioner has to diagnose and understand, okay, what is this person telling me? What is actually I'm perceiving that I have to help balance, or some therapies cure. And so diagnosis would come through a case history. So there'd be a detailed case history of symptoms, the origin, how did it start, what is the duration of it, how did it progress, and sometimes they like to know details. And then they would carry on some observations and ask you to keep notes on certain observations. And especially from an Ayurvedic perspective, we talked about the eliminations. So they would be interested in your urine, your feces, and your sweat output, because this is going to tell them about the ama or about the toxicity, and through the bodily functions, you would be able to infer or interpret what's wrong on a cellular level. Therefore, you can make corrections on the cellular levels. The systems will get corrected, and therefore, you yourself as an individual or person will get connected. So basic observations of pulse, the eyes, the color of the eyes, gives a lot about the rakta, or as we call it, the blood, tongue, nails, face, especially on the skin, the glow, the texture that's there, lips, cracks, or heat that comes out, and the urine, especially the color, the odor, the output. Pulse is very, very, very vital. And I remember doing an observation clinic when I had the opportunity to learn the different disciplines and with Ayurvedic medicine. And you got all these professors sitting up there, and the interns and the registrars, and they're going through patients after patients after patients, and putting their hands onto the wrist. That is where the radial artery is. So you can do that now. And, oh yeah, that's pit, that's what, and that's this, and that's imbalance. And I'm like, I can't even feel the pulse, let alone be able to diagnose. But after 15, 16 years now, I can appreciate that this is an art. And although medical science would say, oh, it's just logic, you just put the fingers in the right places with the right pressure, and you should be able to get it. However, to perceive the subtleness and to be able to diagnose just through the pulse and just through the alteration of the pulse without any investigations of internal or invasive type is what some of these physicians of Ayurveda are able to do. Even TCM, or traditional Chinese medicine physicians, are able to do. And so non-invasive, where you're not harming the patient or not exciting the patient with any of external means, I think would be one of the good therapies. So Vata, the pulse is fast and slippery. Pitta, the pulse is jumpy. And I know that's mine, fiery. Kapha, pulse is slow and steady. And through this, you'd have started relating to some individuals that are in around you, your colleagues, your friends, your family, or what kind of constitution would they be. And therefore, there are certain things that they could avoid, or certain foods that they could avoid, that could minimize their exposure and therefore their chances to ill health. The other important diagnostic tool that Ayurvedic physicians or any physician would use would be tongue diagnosis. You would generally look at the appearance of the tongue. The coating especially is noted. Now, I know we all clean our tongues and we are advised to do so that there's no build-up, but there are certain features that you yourself could observe that will not erode or go away in spite of this cleaning, because it is to that internal ama or toxin that has led to it. And so again, some generic repertoire or generic ways by which these observations can be put. And as you start putting them into the right boxes, you will start getting a pattern of what happens in Vata, Pitta or Kapha. A dry and rough tongue for Vata. Pitta tongue is red, shiny, oily, sometimes has a yellow coating. And Kapha, swollen, moist with a white coating. So you might want to observe this for yourself and see, along with this, along with your pulse, where is it that your tendency towards the dosha is going. Now in all of this, what you want to do is you want to be able to bring harmony or bring control. And bringing harmony and control is bringing you back to the state of health. And in Ayurvedic medicine, this can be achieved through various different aspects. The first, most important aspect is starting at the consciousness. Making a difference up higher level, which will then transfer into the intellect, the mind, the emotion, and then through the physical body. So this consciousness can be achieved in a lot of different ways, and each one of us might have our own way by which we could alert this consciousness. Sounds or mantras is something that you would have heard, you would have used, and a sound here that comes to mind is Om. And you could say it in so many different ways. And when you start learning and when you start going to classes and when you start listening to yogis or Vedic individuals, they would teach you a specific, slow, rhythmic, deep chanting. And you can do this for 3, 4, 7, 10 times. And basically, through these mantras or through these sounds, there are different channels within the body that open up. And as these channels open up, it declogs the ama or the toxins, starts the energy flowing, and as the energy starts flowing, the toxins start getting eliminated, and that helps to restore the balance. So that's one way, or one of the aspects. Other senses or other things that could be used is aromatherapy, different essences. I even remember that in the Vedic literature, you will read that these things should not be applied only when you get disharmony or ill health. These should be something that you should be doing every day as part of your life. So I suppose we apply perfumes, but in the Vedic literature, you would find essences or aromatherapy or flowers that would be used, seasonal flowers, rose or frangipanies, which have healing or aspects in them that would stimulate specific systems, therefore, due to that seasonal nature of it, be able to keep balance. You can go and get them as treatment strategies or treatment plans as part of what you might be needing when the physician diagnoses you. Panchkarma. We'll talk about that in a minute, Panchkarma and yoga, because these are aspects of physical purification, especially when the disharmony or dishealth has gone a bit too further, where intervention or restoration and therefore regeneration is needed. A physician would apply the Panchakarma to you, and there are certain guidelines that need to be followed. Yogic exercises or yoga would be recommended, and this would be to come back into balance, and then continue doing that so that you don't go back into disharmony. Diet, as we talked about earlier, good lifestyle, good diet. Sometimes you might be given a few specific concoctions or sophisticated formulas of herbs, rasayanas, that will help you to align and bring back to the rhythm of life. Certain practices, and especially diagnosis through pulse or nadi vignan. Nadi is pulse. And so through this pulse diagnosis, there will be certain recommendations that would be made. And if you could follow these, then that would influence your consciousness and therefore the consciousness of your people around you, your family, your friends, your colleagues, and on a higher level, the community consciousness. So somewhere, yes, there's a little bit of a complete whole way of living the life. However, you don't have to do all of that. You could do parts of it and some of it, as long as you do it with complete justice, give it a complete go, then the strategies or therapies recommended through Ayurvedic medicine could correct or help restore the balance. So individuals as a whole are treated. Medicines would usually come from plants or concoctions of plants. The concept is there's a psychosomatic aspect, so it's just not physical that needs to be taken care of. Sometimes it might be stresses, mental, emotional, anger, fear, childhood, some basic issue that has led to that change of cells, systems, and therefore disharmony. And along with that, you would be given strategies for prevention. One of the things I remember, and especially it's the winter months when I'm doing this presentation or recording for you, I don't know if you've heard of the holy basil or tulsi, as we call it. It's a little small leaf through a herb, and you'd find it mostly in a lot of places, a lot of houses, nurseries. And every day in the morning in the winter months, in the northern parts of the country in India, you would pluck 5, 7, maybe it's a number that is auspicious, but at home I just pluck a couple of leaves, put them in honey, and then the whole family would have this leaf. So there are certain antioxidants and healing powers within this tulsi or within this holy basil that would prevent you, especially if you had a cough constitution, to getting colds and getting ill health or flu at those times. And it grows in your garden. You don't have to buy or do anything special about it. Just have to water it every day, and good seedling mix or good sort of basic soil. So it's just such preventive medicines for winter, and on the other hand for summer. Mint to cool you down and help the agni or the fire or the digestion on the other hand. So just basic preventive principles would aim to promote wellness and growth. And so what you want to do is you want to re-establish the balance of the energy form of the cells, and therefore deteriorate the destruction, the physical process that leads to disease. I mean, we're not immortal. There's going to be an end as your cells grow old. However, can you slow down this and therefore slow down the suffering that will come with it as this disharmony, or the symptoms, as we call it now and we understand now, of this disharmony comes by? So one of the aspects that a physician, an Ayurvedic physician, could use for you, especially if they diagnose or they perceive that there is some aspects that needs restoration an immediate action, then that is Panch Karma, 5 actions. It's a cleansing, rejuvenating program for the body, mind, and consciousness. So this is a series of therapeutic strategies, therapeutic treatments, where you want to cleanse the body, the deep tissues of any toxins that have accumulated there. You want to open the subtle channels so that you are able to connect with all the different elements and receive healing through it. You want to increase your vitality, your peace, your confidence, and therefore a sense of well-being. Through this Panch Karma process, you will be able to connect with the elements, the sun. Sometimes you might be just asked to go out in the sun and bask. Of course, be careful of the UV radiation in Australia especially. But in India, there would be certain times that you might be able to go to an ashram or a retreat, as you might call it in Western terms, or a health farm, and you would go through this Panch Karma treatment, and you would be living these principles as outlined in the Vedic literature, and you would take with you these habits that hopefully within your own environment, within your own life set, you would be able to continue. And so it's those basic elements of fire, earth, water that you are able to connect. You're able to encourage and eliminate toxics, because that is what causes ill health as per the perception of the physicians of Ayurveda. You want to enhance self-reliance, enhance vitality and clarity, and by doing this, you would slow down the aging process and therefore restore your constitution. It should relax you, and that relaxation will give you a sense or a feeling of well-being. And when all of this happens, your immune system will be strong, stronger in fact, and therefore you will become more resistant to disease, harmful germs that are going to be around you. It's you, your strength, your power to fight them that has increased. And therefore, you're able to eliminate, you're able to fight, you're able to self-restore in a lot of situations. So what are these methods of Panch Karma? Now, before you go through this Panch Karma, there is 2 pre-purification measures that in a way prepares your body, in a way Shuddhikarna, as we call it. I'm using some Sanskrit words because that's what is the motivation or principle behind is you want to cleanse. You want to clean off the toxins so that you can then restore and that pendulum can come back into balance. And you might have experienced it yourself. People might have talked to you. I'm sharing with you 2 of these experiences or 2 of these purification methods. And I've gone through both of these, especially when you go on holiday or retreat farms. And sometimes it becomes a luxury or, let's just do it without perceiving or understanding the deepness and the meaning behind why these principles are applied from the Ayurvedic physician. Nevertheless, it is beneficial, so we do it. And so you have Snehan and Svedna. Snehan is the oil massage. And so oil is applied to the body. There's a specific type or technique of massage through different movements. And what this does is this encourages the toxins to move towards the gastrointestinal tract or the digestive system. And when it gets there, obviously, you will be able to eliminate it through your feces, which is one of the elimination processes. And yes, because the systems are connected to each other, the urine would also be able to see the effects of it. So that basically you're wanting to cleanse through those basic elimination processes, and therefore svedana, or sweating, which is again a way or a method of eliminating toxins. And so this follows immediately after the snehan. And svedana, it liquefies the toxins, increases the movements of the toxins again into the digestive tract, and about 3 to 5 days, depends on how intense and how much the physician recommends for you. The perception is that it rids you of, takes you off all the imbalance, and then you come into restoration of your constitution, your prakriti, and your vikruti, which is your both physical and spiritual constitution. Now, depending upon what is diagnosed through the different observations that the physician has made for you, through the signs and symptoms, depends upon at what level of the chronic disease you are. Other methods, one or all, might be recommended. And these different methods are again encouraging the elimination of toxins. So basically the toxins, the ama, the agni is accumulated, and that clogs the system, and you want to release, make the flow of it, and that's how that is going to restore balance or health for you. So one of the ways you could do that is vamana, or therapeutic vomiting or emesis. Please do not do any of this yourself. Obviously, there's a diagnostic aspect from the Ayurvedic physician that goes in there, and then on the recommendation of the physician, under supervision, through proper guidance, they will take you through any of these when needed. So basically, vamana or emesis is when there's congestion, bronchitis, asthma, excessive mucus or cough might be collected, and so there will be things that will be offered to you, encouraged. It might be herbs that are given to you at the same time. And so what you will find is, and what I found was that some of the patients first thing in the morning would have a whole purge of this elimination of this toxicity which has accumulated overnight. Virajana or purgation, and this especially relieves what we call as the pitta, or excessive of bile disturbance. And one of the symptoms, and I can relate to this very, very well because I've got a tendency towards a pitta constitution. And, you know, first thing in the morning, sometimes you wake up and there's this build-up of pitta in you through the liver, through the gallbladder, and the small intestine. And so what you want to do is you want to be able to eliminate it through the right method and in the right way through the GI tract. And so you will be given herbs which will help you, or which will encourage you to purge or allow it to get eliminated through the digestive system. And you will be given certain instructions of foods of haves to not have because of the intestinal tract, the digestive tract, the sensitivities that will come about through this process that you are going through. Basti or enema, concussions of certain enema. Sorry, you might have experienced it, and some colonic irrigation another way. People might have heard or come across it. It's not the same. The principles would be different, but basically that's what you're trying to do, is medicines given rectally into the deeper tissues, and that's how the doshas or vath could be eliminated. Nasya, or elimination of toxins through the nose, And I've seen some videos where some demonstrations were given. Individuals have been asked to put certain liquids or certain things through the nose from one nostril, and then it circulates all the way around into the other nostril. And so under supervision, this is indicated, and it's mostly for sinus disorders, headaches, and ear problems, and things like that. So there's some logic and scientific reasoning behind it. And Rakta mokshan, or blood detoxification or purification, especially for urticaria, rashes. Sometimes the pith constitution can produce these symptoms, especially if the liver is got affected, which is what happens in the pith constitution. And so what you're trying to do is you're trying to offer herbs, lifestyle changes to detoxify, and this detoxification will lead into harmony. You may be given one or all of these methods at the same time, or you may be given none of these methods. Depends upon the intensity and the duration of the illness or the signs and symptoms. And of course, the physician is the best person to determine how much of this you need. Some advices that would be offered during Panchkarma. Especially you're going through this healing process, it's important that you are able to rest during this experience. You're able to keep warm and away from wind, and observe one's thoughts and experiences during this time, so that if there is any change or any increase or decrease that needs to happen to the strategies, then it can be done. And sometimes depending upon how far you have progressed, especially with a chronic disease, you might be able to go to a health farm, go to an Ayurvedic farm, and be able to go through the treatment itself. Having said that, I'm not aware of any of such things in Brisbane, especially, or in Australia. But it might be that you might be able to do some of these principles while you are at home. A basic diet of liquid rice and lentils, or specific word for it in Indian is mung, and ghee, which helps purification. Restrictions, obviously, of tea, coffee, caffeine, recreational drugs, alcohol, and dairy products. And you might come across in some of the other presentations about dairy and how sometimes it might be good to avoid huge intakes. And all of these substances not to be resumed until sometime after the Panchkarma is completed. Can you do it? Yes, you can. Have I been through it? Not completely. But I have known of patients, I've known of family members, I've known and done some of it myself. And it does rejuvenate you. It does lift you and bring you back into balance. However, what I found was the most difficult part, which some of you might be able to relate to, is continuing and keeping that going for yourself. And so that's when yoga, which I do find is easier to sort of implement and easier to keep applying. And a lot of help is now available to get yourself into this practice of Indian philosophy. It's a way of life, complete harmony of mind, body, as we know it. There are special exercises or asanas, special breathing patterns, pranayama, and a meditative aspect that goes through it. So yoga is a byproduct of thousands of years of research done by rishis in ancient India. Not that you'd aim to live like a logi, but at the same time, what they used to do is they used to go in simple life, simple practices, and the motivation or the aim for this was self-enlightenment. We don't have to have all of those aims, but we can have the aim to be healthy, in balance, and therefore unite with one's own source. And so the yoga that we could do 5-10 minutes every day in our life could help us to get there. Asana, meaning posture. Pranayama, method of controlling prana or life force through regulation of breathing. Meditation, concentrate on one thing. Basic application of these could help restore balance in the toxins and therefore elimination of these toxins. And through the lifestyle of, healthy habits, imbalance will be way, way far away from you. Proper asana. It's a lifestyle that does not allow us to provide natural motion of muscles and joints, and therefore dis-ease or great discomfort will ensure in time. It's all these gadgets that we've got around us. We don't have to even do physical work of any kind. And therefore, the principle of Ayurveda or yogis believe that has led to accumulation of these toxins because you're not moving your body properly. And so a way around this is get yourself into a habit of putting your body into correct postures or asanas for a while, every day, and this will help the motion. And so you can see one of the asanas that's here, which you might have seen or read or known. Just basic crossing your legs, putting your hands either to the sides, on the lap, or just close to each other, straight back, basic sitting posture. Proper pranayam, proper breathing. And when I'm talking to you, I'm remembering, I'm not sure if I paused or took a breath. And how important it is, even physiologically, if you think of it, that process of breathing is to eliminate carbon dioxide. And if you don't eliminate this carbon dioxide through deep, slow, rhythmical breaths, you will collect hydrogen ions and therefore acidity in your body. And so let's just take a deep, slow breath, and through proper breathing or through proper pranayams, you would be able to eliminate the toxins. And there are lots of different types of pranayamas, and there is lots of different literatures and lots of different schools that teach you the ways or details of how these different exercises or breathing exercises can be completed. It's good. I've done, one of my colleagues is actually a specialist and practices Brahma Vidya or type of pranayama, and she shared certain exercises with me, and doing this presentation has reminded me of those exercises and brought my books back, and I've started doing that with the family again. So really good to get into some of these practices. Proper Sarvasana, that is relaxing the muscles as deeply as possible, and through this you would regenerate the nervous system and attain a deep inner sense of peace. And I'm not sure if you've come across literature videos or when I remember we're traveling into the northern parts or some parts of India, and you would come across certain villages and you would find people just in the sand, buried and just lying there still like a dead body, not moving. And that's what it's complete deep relaxation. And you would get scared. What's happened to them? They've gone into this trance, slowed every cell, slowed everything, giving the body, the cells, relaxation. so they can regenerate and then back into performing the daily functions physiologically or homeostatically. That would be. And a yoga principle, vegetarianism or proper diet, and they advocate a lacto-vegan diet, and that is an integral part of a yogi's lifestyle. I'm not saying or advocating at all that please you go and do that, because some of us don't have the constitution that can actually take a complete vegetarian diet. There might be aspects of meat that we might need to take, so please don't take this as a way to change what your lifestyle or what your diet is currently. Go to get a consultation, get advice, seek help, and then through the proper understanding and working with a physician, you might be able to make certain changes which will bring that pendulum, or which will bring that balance back into you. So basically summarizing, for Ayurvedic medicine or for any complementary medicine, the capability of healing lies within an individual. Balanced good health is the foundation for fulfillment of biological, mental, and spiritual processes. Very important to remember that. It's a balance of everything. You have to be able to do everything in your life. And as I said earlier, health is just not free from symptoms. Health is balance so that you can achieve what you need to for the higher purpose of existence. And Ayurvedic medicine, or Ayurveda, helps and aims to enable an individual to bring his or her body into a harmonious relationship with the universal consciousness. I hope you've enjoyed the presentation. Go back and reflect on some of the aspects that we've covered, especially aspects of Kapha, Pitta, Vata, which are the doshas, and it's these doshas and these imbalances that bring about the toxicity. The toxicity needs to be eliminated, can be done through a number of different strategies, a number of different modalities or therapies, and that's what I found, is that you have to get there to the state of balance and stay in that state of balance, and that's when you can enjoy your life.